Welcome to another episode of What Did the Patient Say with Doctors Dana and Lauren Brindisi, sisters and owners of Carolina Functional Neurology Center. We are providing you answers to frequently asked questions and bringing you inside information from real conversations we have with patients on a daily basis. Our goal is to spread the truth on health and healing because we believe everyone deserves to know the answers.
Hi, everyone. Welcome back to another episode of What Did the Patient Say with myself, Dr. Lauren Brindisi, and I'm here with my patient, Chloe. Chloe, welcome on.
Hi, how are you?
Doing well. Thanks so much for coming on to talk to us. So Chloe came to me, it's probably been about a year and a half or so?
About a year and a half.
Yeah. So she came to me initially for migraines, and she's been doing really well. So we wanted to talk a little bit about what her experience has been and how this process has gone. So Chloe, what kind of symptoms were you having initially?
So initially it was migraines just constantly. Would have them every single day, all day long. And then I would have really low blood pressure, just really bad fatigue, just awful feeling all in general. I would have really, really low iron levels. Everything was just low.
Yeah. And some of those visual changes. So that was one of the big
Yes.
things that came along with your migraines was, changes in that peripheral vision, especially on one side.
Yes.
When did all of this start for you?
Really everything kind of started after about May 2020. After that, everything just kind of came on slowly. I think the really big start of it would probably be about September, about 2022, maybe. That's just when everything was like really noticeable.
Mm-hmm. And what type of care did you receive before you came to CFNC?
So I would go to the cardiologist. I went to a rheumatologist. I went to IV therapy about once or twice a week. I've been to many gysts and is along the time.
Yeah, along the way.
Yeah.
We hear that a lot. Was there anything that was helpful before you started treatment with us?
No, not really. I mean, I went to see a chiropractor, and that would help at least with, the overall achiness that I would feel. But other than that, there really wasn't anything that was helpful besides the IV therapy. But really, it was just I still felt down.
Yeah. When you came to us, you were having migraines daily.
Daily, nonstop.
Yeah. It was just a constant migraine state, basically.
Mm-hmm.
How did you find us?
So my cardiologist was just we had done the tilt table test, and he's like, well, I'm really not sure what to do with you at this point. I'm giving you medication, not really sure what to do. He had recommended you guys because he has another 2 people that sees you guys, and he's like, well, just try it, see what you think. And it's been great.
Yeah. So that's awesome. Have you gone back to him?
I have, and he's actually been recommending you guys to other places. I know you guys have your office in Florida that he's been sending people to when they're down there, and he's actually really happy with the results. I'm seeing him once a year now instead of every 3 months.
That's awesome. What was your experience overall at CFNC?
It's great. I love everybody. I love Ashley and Morgan. And the new girl in the front, I can't remember her name, but she's a sweetheart too.
Haley.
Mm-hmm.
Yeah. So when Chloe came to us, like we said, she was having migraines constantly. We did notice she was having some autonomic dysfunction that went along with that. So there were various supports, but a lot of what we were doing was targeting some of these visual centers and brainstem centers that help to regulate sensation to the head and neck. We were working on some of that peripheral vision. You were having those auras that were preceding some of the migraines, as well as, having some of kind of like constantly some issues with your vision. So again, she was really stuck in this almost constant migraine state. And that's being perpetuated by some of these autonomic issues, which we see go hand in hand. A lot of patients that have migraine also have autonomic issues. And for various reasons, we've seen these autonomic issues get elevated for people, with COVID and things like that. And that can just really push you over the edge in terms of managing the migraine overall. So when Chloe came for treatment, we saw her for an initial round, and you did really well. I mean, it was within the first few weeks that we started seeing a reduction in the headaches themselves, which was awesome. And then Chloe has been an awesome and extremely compliant patient in following through with some of the maintenance care. And at this point, you're really just at a place where you've come once a month. And last time I saw you, I was like, you've been doing so well. Really just call when you need us. So how do you feel like you've done overall?
I mean, in complete 180, I feel like I can listen to my body more. Like I can listen to the cues. Okay, maybe I need to slow down a little bit. Like I can understand myself a lot better than I was able to because I don't constantly feel terrible.
Yeah, I love that. We were really impressed. Remember recently you got the flu, I think.
Yes.
And you felt pretty crummy. Oh, I think we maybe lost her for a second. She'll probably hop back on. Oh, there you are.
I'm back.
I was going to say you felt pretty crummy, but you came in for a visit or two, and we were able to get you right back on track, which is awesome. What does some of your maintenance at home look like? As we're not really seeing you in the office very often.
So definitely doing the videos that you sent me on that one app. I can't remember what the app is called right now, but doing the videos twice a day, and then I've been drinking lots and lots of liquids, lots and lots of salts. Have at least like, I don't know, try to have some electrolytes coming in, and it's been great.
Yeah, that's good. Chloe works as a hairstylist, so she's busy on her feet. It's hot. And those were definitely some issues for you originally, and no issues at work these days?
No, just when it's hot, I need to sit down and take a moment, but it's been unreal how great it's been.
And very hot. So it's middle of summer right now, and we've had a heat wave here in North Carolina for, I don't know, going on 3 weeks now.
Yes.
So do you have any advice for people who might be struggling with migraine and autonomic issues?
I mean, kind of take the plunge. Just make sure, you do your research and just take a look at maybe what will help. And I mean, anything that you think will help, try it. There's really no harm in trying, and just try to listen to yourself more is really all I can say. Don't fight it, I guess.
Yeah. Well, thank you so much for coming on and being willing to interview and share your story with everybody. These interviews are extremely helpful for other people struggling with these similar issues. So thank you so much, Chloe, and we're so happy that you're feeling better.